What is Medicaid? Medicaid is a government health insurance program for low-income individuals and families. It was created in 1965 as part of the Social Security Act and is funded jointly by states and the federal government. Medicaid provides access to medical care for people with limited resources who can't otherwise afford it. Medicaid is an important program that helps millions of people obtain access to healthcare services they would not be able to otherwise. It covers a range of services, including doctor's visits, hospital stays, prescription drugs, and other preventive and long-term care services. The federal government sets guidelines for Medicaid benefits, while each state administers its own Medicaid program within these guidelines. The state determines its own eligibility requirements, benefit packages, and payment rates. Federal and state responsibility. Medicaid is a federal and state program funded by the U.S. government as well as state governments that offers health care coverage for those who cannot afford it. The federal government sets guidelines intended to ensure that all states provide access to high-quality health care, while state governments have the power to set eligibility requirements and figure out how to best fit their citizens' needs. The federal government is responsible for funding Medicaid, but the state governments are responsible for administering it and setting eligibility requirements. In addition to providing basic healthcare services, each state has the freedom to decide what additional services will be offered. Services covered can range from prescription drugs and mental health services to long-term care and transportation. It's important to note that Medicaid does not pay for all medical costs. It covers only certain services and supplies, such as doctor visits, hospital care, and prescription drugs. In some cases, states will cover additional services such as dental and vision care. It's important to understand what services are covered by Medicaid in your state. Why is Medicaid important? Not only does it help ensure that individuals have access to basic healthcare services, it helps to reduce disparities in health outcomes between individuals with lower incomes and those with higher incomes. Medicaid also provides vital access to long-term care for older adults and individuals with disabilities, which helps to keep them healthy and living in the community. In conclusion, Medicaid is an essential program funded by the federal government and administered by the states. It provides basic healthcare coverage for individuals who may not otherwise be able to afford it, while also reducing disparities in health outcomes. Additionally, it provides vital access to long-term care for older adults and individuals with disabilities. Who qualifies for Medicaid? Medicaid is a state and federally funded health insurance program that provides medical coverage to certain groups of people who demonstrate financial need. To be eligible for Medicaid, applicants must meet certain income, asset, and medical asset requirements. Income requirements depend on individual and family situation and the state in which the individual resides. Generally, Medicaid is available to those whose incomes are less than or equal to 138% of the federal poverty level, FPL. Asset requirements may also differ between states, but typically, individuals must have assets that are valued at or below $2,000, and couples must have assets under $3,000 to qualify. In addition, applicants must not have received money or other assets in exchange for being eligible for Medicaid within the past 5 years. Medical asset requirements include having pre-existing health conditions, being pregnant, or being 65 years of age or older. Other qualifying factors may include disability, blindness, being a caretaker of a dependent child, being responsible for a disabled or elderly relative, and being a refugee or veteran. Individuals must provide proof of their eligibility and must meet all of the required criteria to receive Medicaid benefits. By understanding the Medicaid eligibility requirements, individuals can determine if they may qualify for the program. If an individual is unsure if they qualify, they can contact their local Medicaid office for assistance and more information. What does Medicaid cover? Medicaid is a state-run program that provides health insurance for qualifying individuals and families. It is funded by both the federal government and state governments. Medicaid provides a number of healthcare services, including primary care, hospitalizations, doctor visits, mental health treatments, and long-term care services. The range of services that Medicaid provides varies by state. Generally, most plans cover doctor visits, preventive health screenings, prescription drugs, and hospitalizations. Some states also offer coverage for vision care, dental care, and mental health services. In addition, Medicaid may cover long-term care services such as home health care, nursing home care, or personal care assistance. It is important to note that not all services are covered by Medicaid in all states. Therefore, it is important to review your state's Medicaid plan to understand what services are available to you. Additionally, some services may require a copayment or special authorization from the state. In summary, Medicaid provides a range of healthcare services to eligible individuals and families. The scope of services may vary by state, so it is important to review your state's plan to understand what is covered. Applying and renewing for Medicaid. In order to apply for Medicaid, you must first determine if you meet eligibility requirements. To be eligible for Medicaid, you must have limited income and assets, as well as proof of U.S. citizenship or legal residency. You can find out if you meet the income requirements by visiting your state Medicaid website. The website will also provide information about the application process, including how to apply online, in person, or by mail. Once you have completed the application, your state Medicaid office will review your information and may contact you for additional documents or information. They will then determine if you qualify for coverage, and if so, will send you a letter with your approval. This letter will also include information about your benefits and how to use them. If approved, you will need to renew your Medicaid coverage each year. Your state Medicaid office will send you a notice when it's time to renew, and the process is usually very similar to the initial application. You may need to provide updated information such as income, employment status, and other changes in your life that affect your eligibility. Eligibility for Medicaid can vary from state to state, so it is important to stay up to date with the rules and requirements for your state. Applying and renewing for Medicaid is an essential step to make sure you have the coverage you need to pay for and access medical care, home and community-based. Medicaid provides home and community-based services, HCBS, to individuals with disabilities and those who are aging. HCBS includes services such as personal care, nursing services, and home health aides. These services can be provided in the home or in a community setting, such as an adult daycare center. These services can help individuals maintain their independence and stay in their own homes. Mental health services. Medicaid also provides mental health services for individuals of all ages. These services include counseling, therapy, and support services. Mental health services can help individuals cope with stressors, cope with disabilities, and work through difficult emotional situations. Prescription drug coverage. Medicaid also provides prescription drug coverage for individuals who qualify. This coverage helps ensure that individuals have access to the medications they need to treat conditions such as diabetes, asthma, and heart disease. Prescriptions are usually covered at low or no cost. Dental services. Medicaid also covers dental services for children and some adults. Dental services can include routine checkups, cleanings, fillings, extractions, and emergency services. These services help keep teeth and gums healthy and reduce the risk of cavities and other dental problems. Vision care services. Medicaid also provides vision care services. These services include eye exams, glasses, and contacts. Vision care services help individuals maintain good vision and reduce the risk of eye disease and injury. Conclusion: Medicaid is a valuable program that provides access to quality health care for individuals and families who may otherwise not be able to afford it. It offers a variety of programs and services, including home and community-based services, mental health services, prescription drug coverage, dental services, and vision care services. If you think you may qualify for Medicaid, contact your local Medicaid office to find out more about the eligibility requirements and benefits available. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.